as Sue said, I'm going to give an overview really of some of the research we've been undertaking around bottle refusal by breastfed babies. And this title here is of our latest paper, and it's really what I'm going to focus on tonight is why babies may refuse to bottle feed. I just want to say this title here was, I can't take credit for it. It was a post by a mum to another mum on an online forum, and she's trying to explain maybe why their babies were refusing to bottle feed. So defining bottle refusal by breastfed babies, there's no official definition as such. It has been described as a reverse nipple confusion or nipple confusion type B, type A being when a breastfed baby is introduced to a bottle and sort of gravitates towards it. We came up with our own definition after speaking to mothers and experts in the field. And this is when a breastfed baby initially or continuously refuses to accept a bottle containing either express breast milk or infant formula. Two things here. Firstly, it doesn't really matter what's in the bottle. Our mothers said that babies refused it equally. And secondly, there is a slight caveat to this now, in that mothers have said that sometimes their baby did initially accept a bottle, but then refused it. So it's a slight change. So for those of you who don't know, bottle refusal by breastfed babies is actually really big business. A quick Google at the weekend, over 2 million results. And you can go through hundreds of pages and they will all be about bottle refusal by breastfed babies. Here, over 150,000 YouTube videos on how to get your breastfed baby onto a bottle. Here we have advertising by many bottle and teat companies in terms of they market bottles specifically for breastfeeding babies, and here no more bottle refusal. Very much like the Lancet series, they target mothers. There's a very aggressive targeting. I very quickly, if I go on my phone and put in bottle refusal, I'll start to get adverts on my phone immediately. And we have just started to do research around this and the evidence underpinning this marketing. And here you have individuals. I mean, I don't know whether this person's actually being paid for this, but if you go on forums, people are making quite a lot of money out of consultations in terms of trying to get breastfed babies to accept a bottle. So why is it such an issue? Certainly in the UK, we know breastfeeding is not the norm, and we have a bottle feeding culture. So that sort of socio-cultural narrative that's been built around this drives forward that there's an expectation that your baby should be able to feed from a bottle, even if it's breastfeeding. A bottle is the default, not a cup. We have a lot of babies that refuse cups as well. Feeding in public is challenging, mothers going back to work and not always welcomed in terms of breastfeeding. And there is this unrestricted advertising of bottles and teats for breastfed babies. And as I said, like the work of Nigel Rollins, you know, it's very comparable, really. And bottle refusal has been pathologised, so it's seen as a problem that needs to be solved. We would argue it's probably a normal response by a term healthy baby in most cases. And we mustn't forget there are times when breastfeeding mother wants or needs someone else to feed a baby. As one mother said to me, you know, life doesn't stop when you're breastfeeding. So mothers diagnosed with cancer in our study, hospitalised for up to 12 weeks, really unwell, not able to breastfeed physically. Mothers who are self-employed are the main earner. You know, they go back to work much earlier than 6 months, or certainly a year. And then over 75% of our mothers just wanted to have sort of one-off bottle feeds for their baby. They wanted, you know, a date night, or as one mum said, I don't really want to breastfeed my twins in my wedding dress. There's exams. One mother tragically wanted to spend the last few days with her dying father in IC. You know, there's a whole range of issues why mothers may not, may not be able to, or may be separated from their baby. So our research, I just must say, not all babies cry when they see a bottle of breastfed one. Some just, you know, laugh, almost smile and laugh when they see it. 841 mothers completed an online questionnaire, and that was within just 2 weeks. So we had to shut that down pretty quickly. Out of those mothers, over 350 wanted to be interviewed. So we reduced that down to 30. And we captured about 600 posts from online forums in a month. And it was topic of the hour on Net Mums, I think it was. So you got Net Mums, Mumsnet and Baby Centre. So tonight, I'm going to focus really on what I think is probably the most important area of our research. Why do breastfed babies refuse to bottle feed? I think this can help inform mothers' decision making, the support and advice that they may get, and also their management of the scenario. And just to say, we underpinned our research with a biopsychosocial model, and that's because it was really in recognition that infant feeding, particularly in the UK, is quite a complex area. So here are 4 themes. I'm going to go through those. I'm going to give you some quotes underpinning them, and then I'll sort of centre them in the literature around them. We'll sort of do a support or refute in terms of, are they a credible reason? So these have come from mothers, and then we've sort of immersed them in the literature at the moment. So breastfeeding is the answer to everything. So it was just kind of amazing. It's fantastic how breastfeeding just seemed to sort every problem out. I pick him up, it's almost an instant calming effect, and it's a very symbiotic relationship. It's not even that they're hungry, it's that they've just got to the point that they need to reconnect with the mum. He'll have the tiniest little feed and then he'll be happy again. And you think, oh, he just wanted that little bit of comfort and reassurance. And I think this really points to the non-nutritional rewards of breastfeeding. And there was almost like a psychological dependence between baby and mum. And the babies used breastfeeding for a quick fix or to check in with mum. And quite often they used it as a conduit to gaining mum's presence. And in terms of literature, we know that there's an increased mother-baby communication due to breastfeeding. There's greater proximity between mum and baby and more contact time spent between them. It even provides post-vaccination pain relief, etc. And this very much fits with Carleen Gribble's work that she did with older children when they explained why they breastfed. And they said, it's when they were hurt or upset or when they wanted to be close to mummy. So can it be a reason? Yeah, we would say for some babies, and maybe those who initially accepted a bottle and then realised what they could get from breastfeeding and then began to refuse. So then bottle feeding, an alien concept. He, husband, tried a bottle and sippy cup and she was not impressed one bit. She looked disgusted that he'd even attempted to give her milk in any other way than from source. Eventually, he would take formula from a bottle. He would not take express breast milk from a bottle. It was like, sorry, this is a mismatch. It's not right. I just think it's the alien concept that something in her mouth that's not a nipple. He just couldn't work the bottle. He didn't know what to do. So I think there's 3 areas really that you'd focus on here. First, this biological expectation to breastfeed. Milk should come from the breast only, and that babies are preconditioned and preset to breastfeed. And in terms of literature, we know if a term healthy baby is left post-birth, right after birth, it will self-attach to the breast. So it does have this prime instinct to breastfeed. And for some babies, a bottle was disrupting this. Second, in terms of this thing in her mouth, so mothers really discuss the physical differences, the polarization between this hard, cold nip teat versus this warm, soft breast, and that it could be the physical experience of having a teat in the mouth, and that's why babies refused to bottle feed. And this was somewhat verified by the dummy refusal that mothers talked about as well, where babies really, really would not have a dummy in the mouth either. And in terms of the literature, we know that babies, infants, children, even adults can be very sensitive to different tastes and textures and smells. And also in terms of weaning babies, complementary foods, they don't always like textures, etc. So although taste wasn't implicated in this case because babies refused both formula and express breast milk, certainly the differences in the feel and the texture of the teat could be implicated for some babies. And then finally, in terms of not knowing how to work a bottle. So we know that there are differences in the mechanisms of breast and bottle feeding. And in this case, it was really quite interesting that mothers said how their babies couldn't sort of master this skill of bottle feeding, when it's quite ironic because in the UK it's all about mastering the skill of breastfeeding almost, and every baby sort of, it's a given that they're going to be able to feed, understand how to feed from a bottle. In terms of literature, there is a recent study, I've put it in the reading list actually, by Katowski. It was an integrated lit review, and they sort of suggested that maybe there aren't the big differences that we thought in the past in terms of the mechanisms of breast and bottle feeding. So it could be a reason for some babies, but we also know that babies can definitely feed breast and bottle, without any problems, it seems. Babies are individuals. She would not give up. She would not back down. Now she will take the occasional bottle of formula from my sister, but not from her dad. He suddenly just took it. I did nothing different. To this day, I don't know why. I think we don't allow people enough to acknowledge the differences between babies. This very much stemmed from babies' individual personalities and temperament being described, and the fact that they wouldn't back down. It was this battle of wills, and lots of mothers link this to maybe how their children were going to behave later in life, that they will be the strong personality of the family. And also this individual and unpredictable behaviour that you can see here. In terms of literature, very, very few studies have explored weaning from the breast, and it's usually with older infants. There's a really interesting study, I've put it in the reading list, by Marquis, and it was older children in Lima. And what they found was those who were labelled strong-willed and demanding were able to maintain the breastfeeding status despite the mothers wanting to wean them off the breast. And there are also some case studies where babies, it's been sort of theorised that babies may have this sense of agency and want to be in control of the feeding. So is it a reason? It certainly could contribute to refusal. It might overlap with some of the others. And then finally, find the right bottle and don't delay. So these are all the bottles. I mean, there were hundreds of these posts. We tried Tommy Tipping, Mam, Nook, Advent, the Medela ones, until someone suggested a Mini B. She wolfed it down with that. So there was a strong emphasis on solving bottle refusal, and that if you found the right bottle for the baby, then it would be solved. And this was really based on the narratives from lots of the bottle and teat companies. You find this the best bottle in the world, no more bottle refusal. And the advice given on forums was absolutely prolific, and it was probably paramount to advertising. There's been no research on bottle and teat companies. We've just started to undertake some of the evidence supporting these products. Our previous quantitative study did show that when mothers tried different bottles and teats, the success rate in solving bottle refusal, if you like, was actually very low. So it can't be relied on anyway, and you do spend a lot of money. And then there was delaying introducing a bottle. Hindsight's a wonderful thing, but after having my eldest, I realised the advice I was given by the midwife and health visitor to wait until he was 6 weeks before introducing a bottle to avoid nipple confusion was an utter load off. And this was a post. So there's two things here, really. One, in terms of delaying introduction of a bottle, likely due to this emphasis on routine and sort of medicalisation of feeding, etc. Mothers being told to wait 6 weeks. We haven't found anything to sort of substantiate the 6 weeks yet. But what we did find in our previous study was that it was actually the later a mother introduced their baby to a bottle, it was more likely to lead to eventual acceptance rather than the earlier. So it is fraught with complexity, because what denotes early and late introduction is very difficult to sort of decipher. And also in terms of nipple confusion, it's very difficult to prove this, and it in itself is quite a confusing subject. You don't know whether it's because the baby has been introduced to a bottle that it's sort of gravitating away from breastfeeding, or whether it's other variables. So it is quite difficult. I have put a Zimmerman's article in the reading list too, if you want to read further around that. So, in conclusion, there's no one definitive reason why a breastfed baby refuses to bottle feed, and reasons can be attributed to biopsychosocial concepts. They can be split into extrinsic or modifiable reasons, maybe when you introduce a bottle and which type of bottle, and intrinsic non-modifiable factors, which I think probably hoover up the most of these reasons, i.e., baby temperament, psychological dependence. And importantly, this work adds to the evidence that babies are active participants in infant feeding, and that this is something they do rather than something that is done to them. And that's by Gail Rapley. And there's my reading list. Thank you very much.